In global health innovation, the first step is to engage in deep self-reflection, understanding yourself, your motivations, your privileges, and biases. After you have reached a much better understanding of yourself, it is time to also appreciate the larger space in which you, as an innovator, will operate. Here begins the process of understanding others. Global health is, at its very core, a people-oriented enterprise, meaning you can never solve global health problems alone. In fact, working with other people is inevitable. Throughout your journey in designing and implementing global health solutions, you will be encountering and interacting with a wide array of actors. They can be individuals or organizations. These actors range from the main beneficiaries of your proposed solution, partners that you will be collaborating with, decision makers that can provide you with financial and even political support, or even certain constituencies that may express some level of disagreement towards your project. They are generally called stakeholders, actors that have a stake or interest in the problem or issue at hand. Since global health problems occur in complex ecosystems filled with myriad actors, you can anticipate engaging with many stakeholders throughout your innovation journey. Hence, a good stakeholder analysis is another critical first step, even before you create and implement an innovative global health solution. For instance, if you are in the business of developing new devices for diagnosing diseases, here is a list of stakeholders that you will certainly encounter in the innovation ecosystem. If you are to design a device that will be acceptable to everybody, it is important that you understand the needs, wants, and expectations of different stakeholders. For example, physicians will expect that a new diagnostic device will improve clinical outcomes, as well as their ability to diagnose and treat diseases. Meanwhile, patients will want not only their health condition improved, but also waiting time to be reduced and overall experience to be satisfying. Hospitals, on the other hand, will aim for enhanced efficiency and containing costs, in addition to increased productivity and profit. And regulatory agencies will strive to improve patient safety, that the risks to patients are significantly minimized, if not totally eliminated. All these are important considerations that must be accounted for by an innovator in designing a global health solution. Apart from ensuring that the needs, wants, and expectations of various stakeholders are met, understanding and engaging with others will also ensure that diverse stakeholders feel a deep sense of ownership towards the innovative solution, which is critical to effective implementation and long-term sustainability. Moreover, getting a good grasp of the various stakeholders will allow you to identify assets, talents, and resources that can be harnessed to enhance the design and implementation of the solution. It will also enable you to anticipate potential sources of opposition and devise tactics and strategies on how to contain such concerns and win opponents and turn them into allies. So, how is a stakeholder analysis conducted? There are many approaches, but one commonly used tool in management and even in health policy is the power interest grid. This 2x2 matrix allows you to visualize your ecosystem of stakeholders according to two main dimensions. Power refers to a stakeholder's level of influence in the system. In other words, how much the actor can direct or coerce a project and other stakeholders. On the other hand, interest describes the degree to which a stakeholder will be affected by the project. Individuals or groups that are seriously affected by a health problem can be expected to express a high degree of interest towards the solution on the table. The steps in conducting a stakeholder analysis using the power interest grid are simple and straightforward. While you can surely do this alone, it is best that a stakeholder analysis is performed with your project teammates or even partners and collaborators who are essential in the successful design and execution of the project. First, you must brainstorm with your teammates and identify who the relevant stakeholders are. It is important to be specific in your enumeration of stakeholders. You can even list down specific names of individuals and organizations rather than using broad categories like government agencies, business organizations, health professionals, patient groups, among others. Next, categorize them according to their level of power and influence, as well as their degree of interest in the issue. Then plot them in the matrix. Once you have plotted all the actors in the grid, then you can examine each of the four quadrants and reflect on how to engage with the different stakeholders. The good thing is that there are general principles that underpin each of the quadrants. For instance, for actors in the high power, high interest quadrant, you must manage them closely, fully engage with them, and make the greatest efforts to satisfy them. Meanwhile, for those in the high power but low interest quadrant, you must make sure that these actors are kept satisfied, but you must not overdo it, as they may become bored with your message. Those who have low power but high interest must be adequately informed to ensure that they do not raise new questions or even criticisms that may disturb your innovation process. And finally, you must at least keep an eye on stakeholders who have low power and low interest. Or better yet, try to increase their level of interest and influence towards the issue. Of course, in addition to these simple guides, you must also dig deeper and ask specific questions about these different stakeholders. Who are the allies? Who are oblivious to the project? And who are the adversaries? What motivates them? Do they have financial or emotional interest in the health problem and its solution? Which stakeholder gets involved at what stage? What is their current opinion of your work? And who influences their opinions generally? If they aren't likely to be positive, what will win them around to support your project? If you don't think that you'll be able to win them around, how will you manage their opposition? Who else might be influenced by their opinions? All these questions and more will help you generate specific strategies and tactics for engaging a diverse array of stakeholders with varying levels of power and interest. Finally, and most importantly, make sure that you do not forget your ultimate stakeholder, the patient, the customer, the user. They are not just your beneficiaries. They are your partners, co-designers, knowledge resource, and fellow implementers. Therefore, you must exert double effort to investigate their needs and experiences. One tool that you can use is the persona canvas, which asks questions like, what do patients want? What are their personal hopes and fears, their concerns and opportunities in the workplace? Another tool is the customer journey canvas. The patient experience is not static. They encounter barriers along the way. For instance, from the home to the clinic and on the way back. trying to wear the shoes of patients and users and gaining a deeper understanding of their perspectives and experiences will enable you to design innovative solutions that truly respond to their essential needs. I hope that you were able to appreciate the importance of understanding your stakeholders, especially the end users, so you can co-design global health innovations that people will not only utilize, but also embrace, share, and sustain.